बिस्मिल्लाहिर्रहमानिर्रहीम। ये सेशन स्टार्ट भी AMR से शुरू हुआ और अब ये लास्ट लेक्चर भी AMR से साथ है, तो दरमियान में हमने बहुत सारे टॉपिक्स पढ़े, लेकिन दिस इज़ वेरी इंपॉर्टेंट टॉपिक फॉर ऑल ऑफ यू. So there is no conflict of interest. The word is with infection, and hospitals continues to be a great risk to many who avail the services. You can see everywhere. So in short, germs are everywhere, and at any given time, over 1.4 million people, patients worldwide, suffer from infectious complications associated with the healthcare. So why we need antibiotics? Antibiotics are valuable discovery of the modern medicine. All current achievements in the medicine are attributed to the use of antibiotics and life-saving in serious infections. जब दूसरी जंग अजीम हुई तो तब पेनिसिलिन के इन्वेंशन हुई, तो उस वक्त सोल्जर्स बड़े खुश थे कि जब वो इंजर्ड हो जाते थे तो वो अपने साथी को ये यकीन दिलाते थे कि यू विल बी सेव्ड बिकॉज नाउ वी हैव अ पेनिसिलिन. And the antibiotic used in transplant, dialysis, joint replacement, and suppressed immune system, these are the various critical conditions where you have the choice of antibiotics. But this is the 30% rule, that the 30% of the all hospitalized inpatient at any given time receive antibiotics. Over 30% of antibiotics are prescribed inappropriately in the community. Up to 30% of all surgical prophylaxis is inappropriate, and 30% of hospital pharmacy costs are due to an antimicrobial use. So, Nobel Prize winner Joshua Lederberg said that we are running out of the bullets. टाइम बहुत तेजी से 7 मिनट गुजार दिया गया, ये गलत है. We are running out of the bullets for dealing with a number of bacterial infections. Patients are dying because we no longer, in many cases, have antibiotics that work. So this was considered as a greatest threat to the human health by WHO. In 2004, it was said that the 2 million people experienced hospital-acquired infections, and 90,000 of these infections were fatal. One death every 6 minutes. But now, annual global, this situation will be in the 2050, that it will cross the cancer, the antimicrobial resistance, 10 million, and crossing all the disease like diabetes, diarrhea, and suicide. So 10 million people could die every year by 2050 due to the drug-resistant infections. This was the time of resistance, that as we prepare new antibiotic, the resistance occurs. So the chloramphenicol invented in 1945-50, and the resistance is in 1955-60. Latestly, you can see that linezolid discovered in 2000, and in 2005, the resistance developed against this. So drugs resistance follows the drug like a faithful shadow. So कब हम समझते हैं कि antimicrobial resistance develop हो रही है? When we realize that we face prolonged treatment times, high mortality, high cost, when common infectious diseases and minor injuries, which are easily treatable today, become major health threats tomorrow. When you caught a simple lung infection and nothing can cure you, when medicine once effective suddenly fails, and when individuals and healthcare system have to carry an additional high burden. So Pakistan is a developing country of the South Asia, and it is rich in the antibiotic resistance. Public health amenities such as clean drinking water, proper sanitation, and infection control practices, they are lacking here, and that is why the incidence of the communicable disease are more. So why this lack of access of appropriate antibiotic therapy, regulation in human use, lack of regulation in the agriculture use, surveillance, antibiotic treatment guidelines, CMEs and the microbiological lab data. That is deficient here. So you can see here that the resistance of bacteria is on rise and the antibiotics, new antibiotics is on the downfall. So colonizer and the infected individuals both can spread the infection. And these are the sources in the hospital like instrument, fluid, food, air, and the invasive devices, medical personnel, and the patient flora. All can cause the hospital-acquired infections. Like these fomites in the hospital, computer keyboard, knobs, telephones, countertops, scuffed suits, eyeglasses, pen, pencils, laboratory coats, manual books, all can cause the chain of infection. Common sources like stethoscope, your hands, thermometers, so all these. So the infection spread from patient to healthcare worker or from healthcare to the patient or from patient to the environmental surfaces and from environmental surfaces to the patient. These are the superbugs like penicillin-resistant streptococcus, MDRSP, MRSA, vancomycin-resistant Staph aureus, vancomycin intermediate Staph, and vancomycin-resistant enterococci. And the gram-negative ESBL producing enterobacteriaceae and multi-drug resistant Pseudomonas and Acinetobacter. So you can see here in 2006, this was the situation like Klebsiella, but now whole world is with the resistant Klebsiella pneumoniae. The Acinetobacter, it is the problematic pathogen, and Pseudomonas is the challenge of the disease. So fight is going on. We are making the beta-lactams, we are making the beta-lactamase, we are making the beta-lactamase inhibitors and ESBL, but when bad bugs are there, no drugs, no escape. So Enterococcus, Staph, Klebsiella, Acinetobacter, Pseudomonas, Enterobacter, they are the pathogens. Scenario you can see, you have, if the baby is born and she was progressing to the ICU and she developed a bloodstream infection by umbilical catheter. So father open heart surgery se survive kar gaya, but in nursing home it was a MRSA, methicillin-resistant Staph aureus infection that kills the sister contracts Clostridium difficile during birth and she lived with this unbearable infection through 6 months of the relapses. And mother is being treated for cancer. So hospital infections are, these are the hospitals infections, pneumonia, UTI, bloodstream, surgical site infections. So core hospital services are either the infection control, antibiotic stewardship, and the microbiological surveillance. So these three pyramids you should know, that the antimicrobial stewardship, diagnostic stewardship, and the infection prevention stewardship, patient with possible infection. So should restrict and rationalize antibiotic use by doing the antimicrobial stewardship, and by infection control program we can limit. So how do we combat resistance? या तो हम नई antibiotic development करें, अगर नहीं कर सकते then we have to use the antibiotic in a very proper way and the appropriate antibiotic use. So stewardship means it is a careful and responsible management of something entrusted. So those of us do not developing new drugs. पाकिस्तान एक ऐसा मुल्क है जो एंटीबायोटिक नहीं बनाता, तो हमारा फर्ज ये है कि हम कंजर्व करें एंटीबायोटिक्स बाय एंटीबायोटिक स्टीवर्डशिप. सो एंटीबायोटिक स्टीवर्डशिप ये कोऑर्डिनेटेड स्ट्रेटजीज होती हैं जो कि पेशेंट हेल्थ आउटकम, रिड्यूसिंग रेजिस्टेंस टू द एंटीबायोटिक्स और अननेसेसरी कॉस्ट को रिड्यूस करती हैं. ये इनके 3 गोल्स हैं एंटीबायोटिक स्टीवर्डशिप के, कि इमरजेंसी रेजिस्टेंस को कम किया जाए, आउटकम को बेहतर किया जाए, कॉस्ट को बेहतर किया जाए. इसकी एक टीम होती है जिसमें ये सारे लोग, इन्फेक्शन कंट्रोल वाले, माइक्रोबायोलॉजिस्ट, नर्सिंग, फार्मासिस्ट, सर्जिकल इन्फेक्शंस, ओटी एडमिनिस्ट्रेटर और आईडी स्पेशलिस्ट होते हैं. डायग्नोस्टिक स्टीवर्डशिप दूसरी चीज है जो एंटी माइक्रोबियल स्टीवर्डशिप के साथ होती है. And this is a modern diagnostic in infectious diseases, works synergistically with the antimicrobial stewardship. इसको ठीक कर लें, 5 मिनट स्टार्टिंग में कम थे. Diagnostic stewardship is an integral part of the antibiotic stewardship program and is also essential for infection prevention and control activities in the healthcare. So, अगर आप इन दोनों में फर्क पता करना चाहें कि क्या है, antimicrobial stewardship में use the right drug at the right time, at the right dose, for the right duration. And diagnostic stewardship is obtain the right test in the right patient in order to use the right drug at the right time, at the right dose of the right duration. This is the difference between the antibiotic stewardship and the diagnostic stewardship. You think antibiotics do not treat viral infections like cold and flu. Think you need antibiotics for flu. Think you need antibiotics for sinus aches. Think you need antibiotics for a cough or cold simple. Think you need antibiotics for a toothache. Think you need antibiotics for cloudy urine, which is due to the amorphous urates. So get smart about antibiotic use. Starting off, choosing the most appropriate empiric therapy, maintenance of the therapy, targeted, escalating and discontinuation, and are you treating infection or colonization, route, IV, parola, and time. So the second important thing, why the infection control is important. This is the chain of infection, and for breaking the chain of infection, the equipment cleaning, hand hygiene, and compliance is important. Infection control committee and the infection control team and its functions like surveillance, preventive activities, and the staff training can improve the surveillance should be done on these areas. And where do we start? It should be a standard precaution and the transmission-based precautions. Standard precautions are hand hygiene, person protective, safe handling, follow needle stick injury, safe handling and disposal, managing blood and body fluids, disinfection, environmental cleaning, immunization, and isolation. And the standard precautions are airborne precaution, contact precautions, and the droplet precautions. So the important is hand hygiene. The greatest transmitter of the germs, the most common means of the spread of the infection. 80% of the infectious diseases are transmitted by touch. 10 most common ways of spreading disease are the 10 fingers. So our hands are threat to the life. Just washing can save many lives. So these areas should be washed properly. And अगर आप वॉश नहीं करेंगे तो ये रेड एरियाज जो हैं ये मिस रह जाते हैं. So keep number of micro on your hand by keeping these. Keep your nails short. Don't wear nail varnish. 7 steps of hand hygiene should be remembered. 5 moments of hand hygiene should be remembered before patient contact, before an aseptic technique, after body fluids exposure, after patient contact, after contact with the patient surroundings. Person protective use types, gloves, gowns, masks, goggles, face. इसका डॉनिंग का तरीका और इसका डॉफिंग का तरीका आपको याद रहना चाहिए. इंजेक्शन सेफ्टी बहुत ज़रूरी है. ब्लड बॉर्न पैथोजन से नीडल स्टिक इंजरी से बचा जाए और वैक्सीनेशन होना बहुत ज़रूरी है. शार्प्स का डिस्पोजल बहुत ज़रूरी है और शार्प्स इसमें मिक्स नहीं करना चाहिए बायोजेट. उसका ट्रांसपोर्टेशन बहुत ज़रूरी है सही तरीके से. और वेस्ट मैनेजमेंट में आपको जनरेशन, सेग्रीगेशन, कलेक्शन, ट्रांसपोर्टेशन, स्टोरेज, ट्रीटमेंट, ये तमाम चीज़ें होनी चाहिए. और इसका जो प्रॉपर ट्रांसपोर्ट होना चाहिए. एंड देन spill, you should clean the area where the blood spill is there by making isolation precaution में contact, droplet और airborne जो होती है. contact हम करते हैं clean hand, wear gown and wear gloves only. in contact में हम clean hands with surgical mask and eye protection. and in the airborne, clean hands, closed doors and N95. So hand hygiene gown, gloves, hand hygiene mask and hand hygiene negative pressure room and N95. Cover your cuff etiquettes आने चाहिए. Environmental cleaning होनी चाहिए. Immunization of the employees होना चाहिए. Medicine quality, ये फार्मेसी में है सारे, हम सब इस हिसाब से हैं. हम जब ड्रग देते हैं तो हमें नहीं पता होता कि इस ड्रग की सही क्वालिटी अवेलेबल है नहीं, जिसकी वजह से रेजिस्टेंस बहुत डेवलप हो रही होती है. मोबाइल फ़ोन्स कि हम डिसइंफेक्शन नहीं करते, जिसकी वजह से सारा दिन मोबाइल सैकड़ों जगह पे पड़ा रहता है और कहते हैं, तो ये डॉक्टर्स, डेंटिस्ट और नर्सेज को मोबाइल फोन की डिसइंफेक्शन. आई वांट यू टू ब्रिंग MDR bugs under control. Combat drug resistance, no action today, no cure tomorrow. Stop overuse and misuse of the antibiotics. Help your antibiotics do their job. Take as directed. Finish the full prescription. Help prevent antibiotic resistance. Antibiotic resistance is not coming. It is here now. It is so important that the discovery of the penicillin given Nobel Prize. Antibiotics are losing their power. Antibiotics resistance knows no geographical boundaries. Antibiotics won't make you cold or flu better. Don't ask for antibiotics when you don't need. So get well soon without antibiotics. Always seek the advice from a qualified healthcare worker. So surgery में भी आपको ये सारी चीजें यूज करनी चाहिए. Antibiotics are precious resource. We need to preserve this resource by working together. Attitude is everything. Change your attitude and change your life. Thanks a lot.